In terms of the way that the information about the president's health has been conveyed to the public, it hasn't inspired confidence, both because of the lack of specificity from Dr. Conley, from the way that he's waved off certain questions without explanation of why he's waving them off, but also because he's given some inconsistent information, including stuff that he's had to go back and revise. If you could wave a magic wand and invent a new spokesperson to give us meaningful information about the president's condition that you think the American people should have. You just mentioned a few things there, chest CT or chest X-ray, his basic labs, potential blood gas reading. What are the things that you think that we should demand to know about the president's condition in order to better understand his level of illness?
You bet, Rachel. So anybody that comes in with shortness of breath and we think they're high risk for COVID-19 and then proven in the president's case to actually have it, these are what I want to know, especially if they're gasping for breath. The way the president looked like he was actually audibly gasping for breath after he did what we call a modified stress test walking up a flight of stairs. What I would want to know when somebody like that is, I want to see a chest X-ray and a high resolution CT scan of the chest. Let me take a good look at his lungs and see if there's any type, what we use the term as technical term, an infiltrate or ground glass opacities. Those are technical terms. What we want to know is there evidence of pneumonia, something filling his airways in his lungs? The answer probably is yes, absolutely, because they gave him dexamethasone and remdesivir. There would be no other reason to give those medications. There's no FDA-approved reason to give those medications unless it was for COVID-19 pneumonia. I'd also want to get renal or kidney markers because we know COVID-19 can impact the kidneys. Want to make sure the president's kidneys are doing okay because a lot of patients that go into the ICU for severe COVID-19 pneumonia have kidney failure, need dialysis. Let's see how he's doing there. What about something called a D-dimer? It's a type of lab value that helps us risk stratify the president, in this case, as to whether or not he might be at a high risk for blood clotting. Because as you know, Rachel, this has been talked about at length, COVID-19 patients, especially those in the ICU or with severe illness, are at risk for blood clots. So what does that look like? He didn't even, when asked the question, he was actually asked the question, is he on a blood thinner? Dr. Conley didn't even mention it. Again, these are weird, just almost unnecessary things to try to hide. There's no reason to hide. Why they didn't report on the results of a CT scan or a chest X-ray and these basic lab values. No reason to hide it. We're all understanding that COVID-19 is a difficult multi-organ system disease. Let's try to help them out. Let's explain to the American people what's going on. They should be forthcoming with these details.